Hello, this is Dr. Luke Bosdet, clinical psychologist. This video will cover working with and evaluating negative automatic thoughts, another key CBT technique. To be able to follow this video, you need to have already identified a thought. The most useful thoughts to work on are ones that still feel distressing or are likely to reoccur in the future. See the previous video on completing a thought record for help in finding the right thoughts. There is a danger that evaluating your thoughts is experienced as invalidating, that the message is your thoughts or the way that you see things are wrong and need to be corrected. This isn't necessarily the case. We do know that depression, anxiety, and past trauma can bias and influence the way that we see a situation, often in an unhelpful way. We also know that because automatic thoughts are so fast, they can only capture one part of a situation and neglect other parts. We also know that there are different ways to view something, some more useful than others. Rather than being corrective, this process of evaluating your thoughts instead aims to be more fair and kind to yourself and others. To start with, write down the chosen thought as a sentence. Thoughts that are phrased as questions are better rephrased as statements. For example, what if I fail the test might be written down as, I will fail the test. It is the prediction of failure that causes the emotion. Once you've written down the thought, rate how much you believe it from 0 to 100%. There are many different techniques to evaluate thoughts. I'll cover the most commonly used here. Because negative automatic thoughts are fast, they can sometimes be only partially true or completely untrue. The first technique is to slow down the thought and really examine the evidence. The simplest way to do this is to draw two columns, evidence for and evidence against. This is like putting a thought on trial. The evidence is put forth by the prosecution and defence, one supporting the thought being true, the other that the thought is not true or not completely true. So let's look at the thought from the completing a thought record video. I wasn't invited because they do not like me, originally rated at 90%. So evidence for this being true might be they haven't messaged me for a few days. I wasn't invited to the party. You can't truly know what someone thinks about you. So I wouldn't include the evidence I feel like they don't like me, because as evidence this is not factual enough, because feelings are unreliable. So evidence against this being true might be we've been friends for years. The last time we met went really well. And there might be other reasons I wasn't invited. So you continue to fill out these columns as far as you can for everything that you can think of. A second way is to look at common thinking errors research shows are made in people with depression and anxiety, and see if any of them apply to your negative automatic thought. These include all or nothing thinking, otherwise known as dichotomous thinking. Everything is one extreme or another, and doesn't recognise the middle or the grey area in between. So for example, thinking that you're either the best or a complete failure. Jumping to conclusions, making a quick assumption and not considering any other possibilities. For example, a car turning down the same road as you and thinking, they're following me. Mind reading, believing you know what other people are thinking. For example, that person was judging me and thinking I was an idiot. Personalizing, thinking that something is to do with you when it might not be. For example, the cashier was rude to me because I'm a bad person. Overgeneralizing, taking one thing and applying it haphazardly to other situations. For example, I got rejected after my job interview. I'll never get a job, and I'll always be a complete failure. This short list only covers a few of the many different thinking errors associated with depression and anxiety. It might be worth having a look at a full list to see if any of them apply to you. It is common for the people I see to have double standards. They treat themselves much less kindly than they do other people. Another way to consider a negative automatic thought is to imagine that a friend was in the same situation. Would you say your thought to them? For example, a friend struggled with a new task at work. Would you say to them, "You're useless. You can never do anything right. Nobody wants you here"? If you wouldn't say your negative thought to them, why not? What would you say to them instead? What advice would you give them? It is likely that you are much more understanding and encouraging to a friend than yourself, but there is no reason you should be. These 3 techniques of looking at the evidence, checking for thinking errors, and imagining what you would say to a friend in the same situation can all be done, or you might find that one fits better for you or the situation. I find it helpful to combine everything together and develop a response to the initial thought in a sentence or 2 that feels balanced. So using the example from earlier, a rational response might be, "I'm hurt not to be invited, but my friendships are strong and long-lasting. There is likely another reason I wasn't invited. I will speak to them about it." Rate how much you believe the new balanced thought, and then re-rate how much you believe the original negative thought. So what if the thought is more or less true? There are some bad situations that have happened or will happen. Sometimes there is no alternative way to view something. The first thing to think about is the conclusion you're making if the thought is true. You can find your conclusion by thinking, assuming my negative thought is true, what does that mean? Or, what does that say about me? So with the previous example of I wasn't invited because they don't like me, the conclusion I might take is that I will be alone forever. Is this conclusion fair, realistic, likely, helpful? You can use the same thought evaluation and balancing techniques already mentioned in this video to consider the conclusion you're making. Sometimes no amount of work on thoughts will help. What you need is action. Take someone who is in a job that they hate, with toxic management and a toxic work culture. The most powerful intervention is to try and find another job, rather than trying to evaluate the way that you think about it. In situations like this, it is better to focus on problem solving. Negative thought techniques here might be used when your thoughts are barriers to making change. For example, the thoughts, "I won't be able to cope with change," or "I don't deserve anything better," might be holding someone back. Other times, some difficult thoughts need to be accepted as they are. I will do a separate video on acceptance. So that is the basics on evaluating thoughts. Some of this might seem quite simple, but remember that simple does not necessarily mean easy. If you have any questions or issues about evaluating thoughts, please leave me a comment below. Or if you're one of my clients, then you can contact me directly, or wait until the next time we meet. Thank you very much.